Hey guys, this is Dr. John. Welcome to another series of our Back to Play chiropractic rehab and home exercises. So today what I want to go over are a few exercises that I commonly prescribe in my office, and I constantly have patients asking how to perform these exercises, which I'm more than happy to explain. But what I would like to do is offer you a way to go ahead and check on your form, check in with how you're doing it, but also compare it to how I'm doing it, which is by no means exactly perfect. And there are variations to these exercises and these stretches. But the ones that I commonly prescribe, especially pertaining to the low back, are a couple things. One, hamstring stretches. Hamstring stretches are basically going to target the muscles here along the back side of your legs. These are known as obviously your hamstrings. The hamstrings are responsible for a lot of things, but most importantly, what hamstrings are responsible for is low back tension. So a lot of times when these things become hyper tight or extra tight due to our ergonomics, our modern human posture, which a lot of us, it's sitting at a computer desk or putting ourselves in a static or stationary position for long hours of time. What this does is allow that supple soft tissue to start hardening, becoming more dense, and essentially becoming more almost glitching out, if you will. So becoming into like a hyper state of spasm from weakness that is generated over time. So to get around this, what we want to do is stretch these guys out. The hamstring doorway stretch, you want to use a doorway that you don't mind shoe marks on, or take your shoes off, even better. And you want to toss the leg you're not stretching through the door, right? And then you want to start far enough back away from the door so where you can actually get a decent assessment of where exactly you're tight. At about 45, which a lot of people are, you can hold that for about 20-30 seconds. As you get closer to the door, you obviously get more of a stretch. So you should hold this for about 20-30 seconds, move a little closer. The idea is to breathe through your belly, allow that muscle to really relax and unwind from here. So then after you perform that, you would essentially switch to the other side or turn it around and would go ahead and stretch that way. Another exercise that I'd like to demonstrate is bridging. So bridging is basically done low back exercise. We're engaging glutes. We're allowing those hamstrings to regain some of their proper positioning as well as their functioning. But we want to do a nice squeeze through the glutes, a slight heel dig with the heels, and around your hips down into your low back. And then you want to make sure that your belly button is pulling in through the floor. And then you're going to just simply lift and squeeze. The squeeze is much more important through the glutes and through the abs than it is just simply flinging your body up. You want to be feeling this engaging in the glutes, not in the hamstrings. It's a clear imbalance when you feel more work being done in the hamstrings that the glutes aren't firing. So this whole purpose of the exercise is to get these glutes to turn on or those butt muscles to turn on. Another thing you can do is put a slight small ball between your legs and do a slight squeeze inwards or internally, or you can take a TheraBand or some sort of exercise band to do a slight amount of pressure outwards. And then what that does is it actually helps engage some of those hip stabilizers, including those glutes, and helps bring those guys into contraction. Again, the idea is to squeeze in the belly first and your abdomen, really engage the core, and then round one vertebrae at a time into a nice flat plank. You don't want to be overextending your belly or allowing yourself to sag. You want a nice firm line right through here. If you find that you're not able to do that, then don't even come up as high. Even a simple squeeze through here, just enough to clear the ground and back down, is sufficient.